we will go ahead and get started because I know everybody's time is certainly valuable. It is 2 o'clock. The reason why you're attending this is our open enrollment meeting. And we have had some changes that we have been able to reach tentative agreement with all of our 4 bargaining units. So today we wanted to share what those changes are. I also wanted each of you to know that we are recording this session, so that those that certainly can't attend, or if you need to go back and review something that we went over today. There is a chat feature. If you toggle at the top of your bar, if you're not used to this Google presentation, Google Meets has a feature at the top with, it looks like there's a little number 4 at the top. If you click on that icon, you'll be able to see the chat feature. If you do not want to talk, you can enter your message at the bottom. Hold on one second. There are other people joining us. So if you enter your message at the bottom and then you just push enter, it will allow others to see your message. So what we'll do is CBiz, Liz Logston and Becky Lewis and Benjamin Morris will be going over a presentation today. We will answer questions if you want to put them in the chat at the very end, so that we have an opportunity for everybody to kind of hear the presentation, and then we'll come back to any of the questions, okay? So Liz, I would like you to start the PowerPoint presentation.
Great, thank you very much, Jane. Hopefully everyone can see. I am not going to try to present it larger because I'm afraid that I'll mess something up. So I'm just going to keep the current view. I hope everyone can see it. It is the open enrollment session for Garrett Board of Ed. Open enrollment is your annual period when employees can review and make changes to their benefits, i.e. switch plans, drop coverage, drop dependents, whatever the case may be. Open enrollment this year will run from June 3rd through June 15th. Everyone will get a new ID card, and any of the changes that we talk about will begin on July 1 of 2020. Changes for 2020 is a slight increase to premiums, as well as some changes to the medical plan designs for all 3 plans. A voluntary maintenance choice for the prescription drug plan will be introduced. Your dental plan with Delta Dental will remain the same. However, the vision plan will be a separate election going forward. Today, everything is bundled, so if you elect medical, you get dental and vision. After July 1, you'll either have to not elect vision or elect vision, and that comes at a 50% active employee share cost. So just remember, you'll have to elect vision this year if you want it. We always try to help educate you on your deductibles and different issues in your medical plan, or not issues, but different features in your medical plan. One of the most important, of course, is your deductible. Each plan has a different varying deductible, and based on your own usage, you can choose which plan will best suit you. For example, under the point of service, the deductible or the annual deductible, which runs from July 1 through June 30, is $550 per person, and then family, it's $1,100. That's an in-network deductible. Out-of-network is higher. And then your annual out-of-pocket, which is very important, is $4,400 for the point of service and $8,800 for the family. I'm going to go through all of these. What's important is for you to think about your own health care and your family's health care and pick the plan that works best for you. If you have a deductible, then the premium's a little less than you're paying for out of your paycheck. The HSA plan, or the high deductible, qualified high deductible plan, this is a plan that's used a lot across the United States, especially outside of the municipality.
Liz,
Yeah,
I'm going to stop you just a second. I'm
sure.
sorry. If, could everybody please mute their mics? There's a lot of feedback. If you're not speaking, if you would mute your mic. Thank you very much. Liz, go ahead. I'm sorry.
Okay, thank you. Oh, I think that's better. Thank you very much. So I'll just start over real quick on the qualified high deductible health plan. This does have a high deductible. You'll see it's $2,200. But if you're between the age of 20 and 35, this might be the perfect plan for you. If you're not seeking services other than preventative, this is a good plan. Also, to make sure you understand that there is a HSA or a health savings account associated with this qualified high deductible plan, and you can place dollars in that account, number one, to pay for your deductible, but number two, it's an extra savings that you can have on the side for services. And then it also has you can roll those dollars out into a savings and use them, but they'll always be only used for health reasons. The next plan is your point of service. This plan has, the middle of the road kind of deductible at $550. And then as you move down, you'll see the different variations. You've got $4,400 for your out-of-pocket maximum, $40 copay for a PCP visit, and then a specialty care office visit is at $50. And again, you just want to make sure that you're matching the plan that are offered by the Board of Ed to your own health care. The PPO plan, this plan only has a $55 deductible or $110 for family. So you're going to pay less when you're seeking services. You're going to pay a little bit more in premium. The next item is...
Can I ask a question really quick? I'm looking at my health card. How do you know which one you're in?
This is Liz. I do not have eyes on your card. I would have to refer to the HR to tell you which plan you're in.
I mean, I don't see PPO or POS anywhere on the card.
Okay, well, can you chat your name, and then we can look up which plan you're in.
Okay, yeah, it's Brian Price.
Liz, this is Jane. So Brian, you're right. I'm looking at my card right now. It does not say that. It does actually, your plan, if you look at your deductions from your pay statement in the portal, it does say which plan you are on. So that's one area. If you don't know, please contact us and we will help you through that process.
Okay, I'm pretty sure I know which one, but I was just trying to make absolutely sure.
Brian, hold on one second. It's also on your sheet when you log into the app for the open enrollment.
Oh, okay.
Okay, it's also on that sheet. Is that correct? Yeah. Okay.
Okay. Thank you.
You're welcome.
Great. So in front of you now is your prescription drug coverage. This is for your qualified high deductible health plan or the HSA plan. Again, the HSA is a different type of animal. You will have to pay out of pocket until you reach your deductible and then go into the co-insurance. So just know that if you do have this plan, come 7/1, you're paying for those scripts until you hit your deductible. The next two charts on this page are your point of service. You have a prescription retail up to 34-day supply. Your generics are 20, 50, 75. That's 20 for generic, 50 for preferred, 75 for non-preferred. And then it has the specialty drug copay there. You pay 15% up to $200 per script. There's another feature that you need to pay attention to when you're selecting your plans. If you're on a specialty drug, you want to be aware of what it's going to cost you if you're in this plan. And then the prescription or the mail order delivery is listed there too for your generics, 40, 100 for preferred, and 150 for non-preferred. You won't see a specialty mail order. Typically, specialty is not mail order or come in or is listed as a 90-day supply because of the cost. The bottom chart is your PPO.
Is that going to go from 34 to 90 days? Can we still do 90-day prescriptions?
Yes.
Okay.
The 90-day supply is not going away. I just happened to mention that your specialty, that's the 4th tier, typically does not have mail order or a 90-day supply on specialty because of the cost. Your PPO is at a 20, 40, 75 copay. So it's 20 for generic, 40 for your preferred, and 75 for non-preferred. Just remember when you're seeking services for the first time, maybe you're going on a new blood pressure medicine or cholesterol, such as myself, see if there's generic first. Generic's going to save you the most when you fill your prescription drugs. CVS Caremark was great news. I mean, you should try to do 90-day fills at CVS. You save money. You can have them mailed to your home. You can choose delivery. Not sure if I'm doing delivery in Garrett County, but you certainly can pick up us at the CVS. And 90-day fills are going to save you money. And ease too. And that is a voluntary product. Voluntarily, you can do that. CVS Caremark, there is a website you can access at any time. There are money-saving tools on that website. You can look at your prescription history. You can compare drug costs. You can check if you have a drug interaction. So if you're going on a new cholesterol pill, such as myself, is there something else that's out there that could interact with that drug? Hopefully your pharmacy and your physicians are helping you with that, but if you want to do your own research, you can. You can track your refill status, learn about any medicine. You can put an app on your phone so you're always knowing when your drugs are needed to be refilled, all those types of things. Choosing the right health care setting. Remember, Teladoc is out there. You can use Teladoc. Maybe you have pink eye or upper respiratory infection, a little allergy thing going on. You certainly don't want to go to the physician at this time just because they're probably overloaded and you don't want to be around a lot of different people. You can certainly use Teladoc. The most important thing about Teladoc is doing your password and your username today before you actually need it, because when you're sick, it's kind of a pain to go through all of that process. You want to have it all set up so that you can just call and get the services that you need. Of course, if Teladoc doesn't work, you can go to a retail clinic or a convenient care clinic. There isn't any in Garrett County per se, but if you're on vacation, you could have a minor scrape or a burn. You could go into a CVS, or even sometimes grocery stores will have a little mini clinic inside there that you can seek services. Of course, you can always go to urgent care, a walk-in clinic to seek services. And then finally, if you need to go to your doctor's office or your emergency room, just know that the average cost is around $225 for your doctor's visit, and then emergency rooms around $749. So something that you can wait till Monday to go to your doctor, that would be great. But if you have to go to the emergency room, please go. UMR is your medical provider, and of course CVS Caremark is your prescription drug. We've got the phone numbers there for UMR. Of course, they should be on your card. It's interesting that it doesn't list which plan you're in, but at least you'll know who to contact. All right, I'm going to move on to Delta Dental. Just remember, you can chat any of your questions, and we'll get to those at the end. Delta Dental will still be your dental care provider. They have lower costs. Delta Dental's allowances mean lower fees to Delta Dental participating dentists and lower costs to you. Your dentist will not charge you any more than your co-insurance or your deductibles when you're seeking that dentist that's in network. Claim convenience, your dentist is doing that for you. And dentists typically like Delta because they process claims very fast and they get their money fairly quickly. Largest dentist network in the United States. So if you have children in college in other states, more than likely they'll have a dentist nearby. Use the friendly service, Delta Dental DPO. You can call them 8 to 8 p.m. if you have a dentist question, and just make sure that you take care of your teeth and go to the dentist twice a year for your preventative services. They're at 100% no cost to you. And there's a diagram of your plan design right there. You're at 100% for diagnostic and preventative, 80 for basic restorative, and then 50% for those orthodontics and orthodontics. It's a nice plan. You have a $1,500 or $1,200 maximum. It's a very good plan. NBA will be your vision provider. As we stated earlier, the vision plan will be a separate election with a 50% active employee cost share, but the plan design is remaining the same. You get an examination once every 24 months, lenses, frame, and contact lenses once every 24 months. Just make sure when you seek services from your dental or vision provider, take a copy of your plan design, because there is a discount plan that's attached. So you can get in, if you need another exam, you can get some discount on that, as well as if you needed more lenses, contact lenses, or lenses and frames. So make sure you take a copy of both of those plan designs when you seek services. And there's their website with a username and a password, and their phone number as well. Typically, you do not get an ID card for vision, so you just give them your social security number, and they'll be able to verify benefits through Garrett Board of Ed. Deer Oaks is your EAP provider, or employee assistance program. Great value, especially during this trying time in our society. You can use EAP to have 3 or 6 face-to-face or telephone-based calls. Anything beyond that, you will have to go through your medical plan. They're just there to provide short-term assistance. If it's something that needs further help, then they will refer you to, if you needed legal services, you would move on to maybe a professional, somebody who's, licensed in whatever legal services that you need, but they can help you get to where you need to go. And access these services, there's www.deeroakseap.com, and there's a username and password. Garrett County Schools, very easy to remember. There's their telephone number. You can also be an advocate for Deer Oaks as well for EAP. If you know somebody is struggling, a coworker, you can pass that information on to them and say, hey, maybe you need some help, or maybe they have a family member that's having some issues, they can use it as well. Again, open enrollment is your opportunity to make changes to your plan elections. You can add or drop coverage. If you don't do it now, the only way that you can do it throughout the year is if you have a change of status, which is birth or death, marriage, those divorces, loss of spouse's job, or if you've gained other insurance. Those things could allow you to make changes throughout the year. You certainly want to check with your HR department to make sure that they're advisable changes. We're going to move to the Wellbeing Incentive. I just want to check the temperature of who's out there. Ben, are you on?
Yes, I am, Liz.
Great, thank you. This is Benjamin Morris. He'll speak to you on the well-being.
Sure. So just in the past years with the Wellbeing Incentive, it will be the same as it is moving forward. You can complete a biometric screening and the online questionnaire, the clinical health risk assessment, or complete 4 of the online missions for Ventures and Vitality to earn the Wellbeing Incentive, which is $600 for an employee, or $50 per month. And if a spouse is on the medical plan as well, he or she has the opportunity to earn an additional $300 or $25 per month towards your premium, the cost of your medical premiums on an annual basis. If you want to go to the next slide, Liz. And then something added this year, the nicotine and tobacco surcharge is also going to include spouses that are on the medical plan as well. So last year, employees just needed to submit an affidavit stating if you were a tobacco or nicotine user, if you were not, or if you were and were wanting to go through a cessation class. This year, the same thing will take place, and one will be for the employee, one will be for the spouse. You will have the entire plan year from July 1 through June 30 of 2021, depending on your status. If you are a user and are going to attend a cessation class through either UMR or the health department, and just prove that you attended the class, you can offset or avoid the surcharge of $600. And that surcharge is both for the employee and for the spouse. If you are not a user and you just submit the form, you have nothing to worry about. And if you are a nicotine or tobacco user and are simply electing not to go through the cessation class, then you can anticipate that surcharge to be assessed beginning July 1 of 2021. And to the next slide. If there are any questions, not only about what I discussed, but anything Liz has covered up to this particular point, please feel free to either message them, feel free to ask us live. You can always follow up via email, touch base with the HR department, and they'll be more than happy to get in touch with one of us regarding the question.
Great, thank you. Jane, did you have any?
Yeah, I just wanted to address some of the questions that people have asked, and I think I'm the interference here. So I hope you can hear me. I know that their question was asked about, are the well-being incentives applying to all the plans? The answer is yes. For example, if you look at the rate sheet that was sent out today, I'm a POS individual. So when I look at my individual amount on that rate sheet, it says $62.63 is what I would pay for the employee cost per month. So when I take that, multiply that by 24, because there are 24 pay periods that our health insurance is deducted from. Then I discount my $600 because I went through my well-being activities. I qualified for it. Then I get my annual amount of $893.52 from that. Then I have to remember that we have a distribution surcharge that does apply. That was that $1.14 that now has been increased to $2. So it's a total of $48 for the year. So then I have my amount of $941.52 that I would pay annually for healthcare under the POS individual plan. Then if I take that total amount divided by the 24 pay periods, my amount for an individual POS would be $39.23. So I just wanted to give you that example because I know that was something that there were a lot of questions about the rate sheet. The next question came up about what is applied for the qualified high deductible from the employer. That amount did go up. It is $1,100 per family. Let me just check this chart to make sure there's anything else I haven't answered. Yes, this is being recorded, and this will actually go out in two different places. One, it'll go out in a link. When you look at the email that I sent out yesterday, there were 4 documents. One, there was the memo that kind of outlined everything, which also told you about this meeting, then there was a benefit guide that is actually a PDF version, but there's also CBiz, and thank you very much, Liz, Becky, and Benjamin. They worked really hard on a virtual book. So it's a really neat, it even makes the sound of the pages being turned. I thought that was cute. Then, of course, the rate sheet that I just went over, an example of myself, how to find what I would pay per pay. And then the app instructions. So if you go on the Open Enrollment app, you'll be able to also find this video, this meeting that's recorded. It's going to be, it has a page up for itself there. So I hope I answered the questions that were in the chat box, as well as what items were sent out. We also have, for our retirees under 65 that are on the line in this meeting, we also had the same documents that I just described were also sent to you in a different email by Kendra Berry today. So does anyone have any other questions or anything that we have not addressed?
Hey, Jane, just want to say thank you very much for everything. And you made this a lot easier to go through this year and to work through the process of everything, especially with all the changes and everything. But kudos to you and your staff and to CBiz. Appreciate it.
Thank you very much. And I do want to say, Eric Cosner has worked really hard to give us this virtual opportunity on the Open Enrollment app. I really appreciate all his work and time on this, as well as Kendra Berry and Angela Flanagan, the behind the scenes working with CBiz. We're really hoping. One thing with this COVID-19, I think it's made us really look at all of our processes and looking to see how we can be more efficient on things. So thank you very much for that. And are there any other questions that anyone has?
So Jane, you had said I can drop tests when she picks her job up, but it doesn't have to be in that window, right? Because that's a major life event.
That's correct, Luann. So yeah, anytime there's a major life event, if you have a baby, if you get married, get divorced, your child has a job, but there's also, you have to verify that.
Okay.
So that actually would come on a letter. Kendra Berry will actually work with you once that happens. Now that I know that, I'm going to have, Kendra will work with you to make sure we have the proper documentation for tests, okay?
It just doesn't have to be within this window.
That is correct.
It can be whenever she's officially hired. Okay.
That is correct. You're welcome.
I have a quick question. Recently I took my daughter to an orthodontist appointment and just like 2 weeks ago, and I was billed a $5 COVID fee. I'm just wondering if anybody else has had that experience.
The dentist is billing a COVID fee for cleaning the room, for sanitizing the room after you leave. Yes, the dentist is.
Okay. All right. I just wanted to know whether that was something I maybe needed to bring to attention to someone, or whether that was just going to be the standard operating procedure from this point forward. Okay. Thank you.
To that end, has anyone experienced anything in a doctor's office? Are they applying any additional charges? So it just must be the dentist.
Thank
Okay. I'm sorry, whoever just said that, we couldn't hear what you were saying. Can you say it, or can you type it in the chat box?
I said they shouldn't be charging us a fee to clean after they've had a patient anyway. That's what they're supposed to be doing.
Yeah.
That's ridiculous.
Yeah. Yeah, I agree with you.
Hey, Jane. Can you hear me?
Yes.
It's Jane Brittner. How you doing? Hey, I have a question. When you have one child, is that considered a family? Or is that still staff and child?
Well, so when you look at the chart, there is actually individual child, individual family, individual spouse. So there are different tiers.
Okay.
Do you see that? Can you see that, Jane?
Not unless I go back. I'll go back later and check it. I just wanted to ask you before I,
But that actually, Jane, you just brought up a good point that I just wanted to make sure everybody was aware. When you look at that rate for the medical plans for active employees, so this again is relating to active employees. So when you look at the vision cost, we don't have a tier for 2 employees. If there are 2 employees, it would be employee spouse cost on that sheet. Okay. Any other questions about anything? Well, I do appreciate everybody being involved today. It looks like we had 99 people. That's the largest open enrollment meeting I think we've had. So that I'm really happy that you're here with us. If you have any questions, please feel free to email us. We'll be sure to answer that question as quickly as possible. Also, I do want to thank again Liz, Benjamin, and Becky at CBiz for helping us. Also for Eric and Kendra and Angela, thank you so much. Again, if there aren't any other questions, and I'm going to just pause a minute. Angela, have we answered all the questions in the chat box?
Sorry, I had to find my mic. I think we're up to date on all the questions in the chat box, yes.
Good, good. Okay. So, if there aren't any other questions, I again thank everybody for doing what you're doing every day, okay?
Jane, there was one question that just popped in about FSAs.
Okay.
Liz or Becky, could you provide a high-level overview of what an FSA is and how that works with the Board of Education, please?
Sure, this is Liz. We do have a flexible spending account, both medical and dependent, at Garrett Board of Ed. Those plans must have an enrollment each year. So if you're in the flex today and you want it again after 7/1, you will have to do the appropriate item. I'm not quite sure how you guys are doing it, but you need to enroll again. Flex dollars can be used for co-pays, co-insurance, deductibles, things like that that are out of pocket. You do want to be conservative on your election. because if you don't use it all, there's a possibility of you losing some of those dollars. And you also want to make sure that your dependent care piece, you're actually using someone that you can either have to provide a social security number or a tax ID of a company that you're using to, babysit your children. Although currently, I don't think anybody is having to do that, but it could come next year or next school year in September. If we're all back to work, you might need to have child daycare. So don't forget about that dependent care and your flexible spending.
Thanks, Liz.
Angela, is there anything else you want to say about the FSA?
You should have received your open enrollment information from Flex Benefit Administrators on Monday. That would have come in an email to you. And that window to sign up for an FSA, if you choose to do so, it is optional. The window is from June the 1st to June the 12th to sign up for an FSA through Flex Benefit Administrators if you choose to do so.
Okay, thank you.
Hi, Jane. This is Pam Humberson.
Hello. Hi, Pam. Are you there? Yes.
Oh, okay. I have a question. Is there on what we need to, and they are supposed to fill them out, and do we email back, or how does it happen?
Pam, I'm sorry. I couldn't hear what you were saying. It was broken up. Kendra or Angela or Liz, if you heard her question, could one of you answer that?
It broke up for me too.
Yeah. Pam, can you restate your question?
Okay. Is there the emails that we just got, is page steps on what we need to do first, and are the forms that we need to fill out and send back, are they included in those emails?
That's on the, let me make sure I'm okay. So Pam, when you go into the open enrollment app, that's where you'll fill out your form.
Okay, and where do we go into the open enrollment app at?
Okay, so so when you look at the email that I sent yesterday, go down the bottom. It'll give you the open enrollment instructions that you actually go through. It tells you all that. It tells you exactly where. It actually provides the link for you. It'll be your username, first dot last name, and your password, just as if you were logging on to your computer. Okay, it has, again, when you get to the instructions, it actually has at the very top the link that you can click on. It is active. Again, thank you to Eric, that you can go ahead and go through that process. When you go all the way through it, it actually walks you through step by step how to enter your information. Okay.
Thank you very much.
You are welcome, Pam. Anything else? Okay, well, again, please feel free to call us, email us. We'll help you through the process. I thank everybody for all the hard work, and have a great day. Thank you very much. Bye.